Yeah, it is legal, but it's still not clear how medical marijuana will make its way into the hands of those who qualify for it.
22 News reporter Eugene Cho working for you tonight to break down what we know so far about regulating legal medical marijuana.
63% of Massachusetts voters said yes to legalizing medical marijuana, and that law went into effect back in January. But licensing and creating a dispensary is still an ongoing process. Medical marijuana is now legal in Massachusetts, but there are still many questions about how that law will be implemented and where 35 dispensaries will be built.
My understanding is that most of the licensing and permitting and all of that needs to be done for both the individuals who want to use medical marijuana and those folks who want to sell it will be done at the state level.
The State Department of Public Health released this draft of medical marijuana regulations last month, and throughout the month of April, they have been getting some feedback from the public. So by the end of May, they will have the final version of the regulations. Here's what we know so far about what the DPH wants. Each licensed dispensary will cultivate its own marijuana. That means no wholesale distribution. Anyone under the age of 18 will need 2 doctor's notes and a guardian approval. And a qualified patient can have up to 10 ounces for a 60-day supply. But there are still some limitations.
You cannot operate a motor vehicle under the influence of alcohol or any narcotic drug. So the law, the medical marijuana law, does not affect that.
It's a very tough issue, and that they need to take their time and make sure they do it right. So I know it seems like it's going at a slower pace than people would want it to be, but they're doing the right thing by taking their time.
And the latest effort to prevent any abuse of this new law comes from state lawmakers. The House voted to ban any sales of medical marijuana packaged to look like popular candies. Live in Springfield, Eugene Cho, 22 News.